Balaji Jaganmohan. I'm a practicing physician and diabetologist at the Apollo Sugar Clinics at Bangalore. Stress is an important factor which leads to a rise in blood sugars. In fact, there are many patients who have elevated blood sugars despite being on medications like tablets and insulin because they're leading very high stress lives. So what do we do to negate or mitigate the ill effects that are associated with stress? So what happens during stress? During stress, there are certain hormones that will try to increase the blood sugars and the blood pressure. What are these hormones? So when a person is stressed based on that particular situation, then there are hormones called epinephrine, cortisol, which will be immediately released in the body, and that would increase the resistance to insulin in peripheral tissue, so glucose will not be taken up adequately, so that eventually leads to a rise in blood sugars, and also it leads to the narrowing of blood vessels, which can even raise the blood pressure. So any person who has been living in a chronic stressful environment might have high blood sugars and even high blood pressure. The best way to mitigate stress is practicing relaxation exercises like pranayama. Pranayama is deep breathing. Any form of deep breathing will automatically activate a system in the body called the parasympathetic system, which is also the relaxation system. The blood sugars will come down, blood pressure will come down, the heart rate comes down, and the person feels more relaxed. Also meditation. If a person can chant any form of shloka for about 5 to 10 minutes a day, that again has shown in many studies that this form of chanting or meditation can immediately try to relax the body. It will try to calm the person's mind and calm the multiple thoughts that that person might experience. That automatically would also try to reduce the rise in blood sugar as well as blood pressure. So trying to lead a stress-free life by mitigating stress through relaxation exercises are something that a diabetic person can take up in order to keep his or her blood sugar under control.